Hello everybody, my name is Julia Simons from Classical Studies, and my talk is Crooked, Hippocrates against the medical maltreatment of hunchbacks. In ancient Greece, hunchbacks were shrouded in superstition, often considered recipients of divine punishment. Physical ugliness was correlated with moral ugliness, and this common belief resulted in people with deformities and disabilities often being ridiculed, excluded, scapegoated, and persecuted. To Hippocrates, however, hunchbacks are not magic, lucky, or depraved. They're victims of disease or trauma whose prognoses are extremely poor. Moreover, Hippocrates advocates for the ethical treatment of hunchbacks and, in fact, all patients, lambasting those ignorant and shameful physicians who perform public demonstrations on them using machinery to perform powerful and dangerous manipulations in an attempt not necessarily to help the afflicted, but to amuse a crowd and make a buck. Hippocrates argues that these doctors are not only utterly ignorant of spinal anatomy, an ignorance which causes them to make many errors, but also that they care more about theatrics than substance. Because of the lack of medical training and ethics, Hippocrates attempts to distance himself from them and their methods of treatment. Take, for example, the Hippocratic Ladder, a device described by Hippocrates whereby an individual was tied to a ladder, which was then forcibly shaken in an effort to reduce the hump. This shaking is called succussion. If the hump is in the lower back, the patient is tied to the ladder upside down at the legs and hips, arms strapped to the body along the side. So the greater weight of the torso and limbs, acting as a pulling force, would straighten out the spine. If the hump is near the neck, the patient's tied to the ladder at the chest and the forehead, the right way up. While Hippocrates does describe in detail the correct and safest way to use this apparatus, he does so in order to mitigate some of the gross malpractice and injury that he sees committed by some of his peers, not because he believes it is an effective method of reduction. In fact, here's what he says about the ladder. When the humpback is due to a fall, attempts at straightening rarely succeed. For to begin with, succussions on a ladder never straightened any case, so far as I know, and the practitioners who use this method are chiefly those who want to make the vulgar herd gape. For to such it seems marvellous to see a man suspended or shaken or treated in such ways, and they always applaud these performances, never troubling themselves about the result of the operation, whether bad or good. And as to the practitioners who devote themselves to this kind of thing, those at least whom I have known are incompetent. Yet the contrivance is an ancient one, and for my part I have great admiration for the man who first invented it or thought out any other mechanism in accordance with nature. For I think it is not hopeless, if one has the proper apparatus and does the succussion properly, that some cases may be straightened out. For myself, however, I felt ashamed to treat all such cases in this way, and that because such methods appertain rather to charlatans. To read modern scholarship on the history of orthopaedics and the treatment of spinal deformities, one usually gets a version that glosses over any condemnation of Hippocrates had for this device or those who used it to treat spinal curvatures. Rather, as the father of spinal surgery, as he's often called, he's usually painted as this device's inventor, which he says he's not, and an outright advocate of its use, which we've seen is not the case. In classical antiquity, there were no accredited medical schools, there was no board exam. One could just roll into town and put up, sorry, I'm one slide off. One could just roll into town and put up a sign, advertise themselves as a doctor, and put on a public display. The Hippocratic physician trained in rational medicine despised these frauds, who not only gave the medical profession a bad name, but caused harm to patients through their ignorance and incompetence, all the while making a profit. About these doctors, Hippocrates remarks, there are many ignorant practitioners, and they profit by their ignorance, for they get credit with their neighbours. Although Hippocrates concedes that the ladder could potentially work, he ultimately places little faith in its efficacy and distances himself from the device because of its use by showboating charlatans. To close his discussion on the ladder, he remarks, but it is disgraceful in any art, and especially in medicine, to make parade of much trouble, display, and talk, and then do no good. And what a display it would have been. Firstly, the ladder method required an open space. It was either leant against a high tower or a roof, which was a rather crowd-inducing setting, or even more alluring to the rubber-necking public would have been the version encouraged by Hippocrates if one were to use the ladder, as it allowed for better accuracy of succussion, and this is the version that we see depicted here. You attach the ladder to a pulley system, the ropes for which are to be manned by assistants who had to be strong and well-trained in order to avoid accident and injury to the patient and to themselves. For example, the ladder could be shaken unevenly, too forcefully. It could come crashing down, jolting the patient and bringing the assistants hurtling forwards. The nature of this apparatus created a conspicuous, eye-catching, grand theatrical scene for the charlatan doctor to exploit. Perhaps the nature of the patient, a hunchback, a marginalized member of the community, proved ideal for drawing in a spectacle-seeking crowd. Statuettes and vase paintings from antiquity suggest people were used to seeing hunchbacks in theatrical scenarios, as they were frequently employed in entertainment as dancers, singers, mimes, jugglers, clowns, and musicians, occupations that were often looked down upon. Hunchbacks, as well as other individuals who did not appear physically normal, were considered objects of curiosity, the appropriate target for ridicule and ribald mockery, as they were considered to be fulfilling their social role of generating laughter, diversion, and entertainment. This certainly explains the crowd's callousness towards the patient on the ladder, although perhaps this ambivalence was shown to all patients undergoing public demonstrations. On this, Hippocrates unfortunately keeps quiet. In general, Hippocrates despises how many physicians care more about pomp and superficial artistry than substance, and how they pander to the general public who are, in the Hippocratic corpus, generally characterized as quick to blame, ignorant about real medicine, and unable to distinguish the charlatan doctor from the real deal. These crooked doctors' goal is publicity, and unlike the ideal Hippocratic doctor, they place profiteering and spectacle before a patient's welfare. Hippocrates highlights the things that should be most important to those practicing medicine: the safety and comfort of the patient, the efficacy of the treatment, and the expertise and ethics of the doctor, things he charges these charlatan physicians not caring about. So in conclusion, I think it's apt to end with Hippocrates' own words on the matter, words that still resonate today. What you should put first in all the practice of our art is how to make the patient well. And if he can be made well in many ways, one should choose the least troublesome. This is more honorable and more in accord with the art for anyone who is not covetous of the false coin of popular advertisement. Thank you.